So Sandrine, welcome.
Thank you.
It's a real pleasure to have you with us today for today's conversation around greening healthcare and how we're going to manage this.
Okay.
So I guess to start with, I'd love you to set the scene and give us an idea of the elephant in the room. So what is the scale of the challenge we're facing? What are the carbon emissions we're impacting on? And where are we going to go to next?
So a lot of challenges indeed. So just to contextualize a little bit, that now it's obvious that the link between the climate and health has made a lot of damages and will be worse and worse in the next decades. So the crisis of health because of climate is a challenge, in the biggest crisis that is expected in the next century, because with the rising of temperature, with the degradation of the quality of the air, a lot of disease will be exacerbated. I mean respiratory disease, asthma, allergies, cardiovascular disease, flu, and infectious disease as well. So what does that mean for the healthcare system? That means that most of the healthcare infrastructure will be overwhelmed by the number of patients that will come because they are facing a new disease or because of the rising of temperature. And so in almost all countries in the world, we see that if the temperature increases by 5 degrees, a lot of people are either dying, but also are going to the hospital in order to be treated. So this is one of the challenges. But at the same time, the healthcare system is not resilient at all to the climate. And so the infrastructure are not ready because they are using a lot of fossil fuel, for example. There is some breakdown in electricity or shortage, and so they can't cold anymore their premises. So this resilience is also another challenge for the healthcare system. Meanwhile, the healthcare system is emitting 5% of the CO2 emission in the world. It's absolutely huge. So we used to say it is twice airlines. So I know that the aviation is making a lot of progress, but it's huge. And so we discovered by making some analysis 4 years ago, that in this 5% of CO2 emission in the world, 15% have the value chain. 5% are R&D, and 45%, that was a big surprise, if I may say, is a patient care pathway. Meaning the pathway of the people from prevention, diagnosis, treatment, monitoring, and in certain extent, complication.
So maybe you can give me a little bit more on the end-to-end of that supply chain.
Yes, exactly. So on the supply chain, what we did, having those figures, because it's important to measure in order to make improvements. So all the pharma companies started to work for many, many years before the result of this analysis in how we can decrease or improve our CO2 footprint. Scope 1, Scope 2, quite easy, if I may say. It's just a transformation, innovation, and particularly in our manufacturing plants. But it's also the value chain. And the value chain is about 87%, Scope 3, 87% of our CO2 emission. It's huge. And most of them is a supply chain. So meaning that we have to work with our suppliers, to embark our suppliers, and this is what we are doing with our competitors, if I may say, who are no more competitors, because that we know if we are doing collectively the effort, it will be easier in order to embark our suppliers. So we engage some collective actions, such as buying some renewable electricity or energy, because thermal energy is also concerned by that. And so in order to provide and to bring this energy to our suppliers. So making this collective effort is important. Particularly on our products, we work also with some suppliers in order to change a little bit the way they manufacture what we call the active ingredient in order to decarbonize as much as possible, which will have an impact on the product and an impact in the patient care pathway as well.
So you have a lot of common suppliers as well in the pharmaceutical industry and healthcare, which is a common setup. But on the back of that, how does it balance out? How do you have a fair setup in which the suppliers are equally rewarded?
So we have common suppliers indeed, but so you know that with our other pharmas, we are not exactly on the same disease treatment and same therapeutic areas. So what we are doing, we are creating a kind of coalition, working with 1 or 2 suppliers of energy, for example, because this is the most important example. But we are working also, we had a conversation interesting this morning on transportation as well. So how to transport our products and how we can change a little bit our logistic across all the sector in order to make it greener. And so as we are speaking about vaccines, as you may know, the cold chain is very important. With the rise of temperature, it will be a big challenge for companies producing and manufacturing and selling some vaccines, particularly in hot, if I may say, countries. So we are working all together in order first to find new technology in order to find the best boxes in order to keep vaccines quite cold. For sure, we try to find vaccines who doesn't need anymore some cold chain, but so it's a challenge, and so we face that with the COVID vaccines particularly. So to change the technology of packaging in order to transport the vaccines in the right way, but also to optimize the path in order to deliver the products, and so to pay attention to be the shortest as possible. So, but it is a collective approach. So we know that we are not at the right pace, but we must be aware that in terms of technologies in pharmaceutical industry is super complicated to change something, because the safety of the patient is first. so this is what we are trying to challenge as well.
So perhaps we could touch on the regulatory side of the challenges that you're facing on the back of, as I mentioned, the challenge of you having to dive right into that and deal with the patient at the forefront. Yeah. How do those regulations, how do they affect you?
So this is a very important question. First of all, pharmaceutical industry has started to design their products differently, to eco-design their products many years ago, 10, 12 years ago. So why they are not still on the market? Because we face different challenges. First, the technology is not there in order to replace one active ingredient with another one. If we want to do so, we need to restart clinical study, we need to restart stability, so a lot of studies are needed, and so it takes many years. For example, the packaging. If we want to change the packaging of a product, we need to ensure, so you know that you have a deadline in order to not use anymore the products. So we need to ensure that before the deadline, the new packaging will remain the products with the same level of safety. So meaning that we need some 4-5 years of study in order to ensure that after 5 years, the product is still safe. The second point is, so after technologies, innovation as well is something that we need to apply. I don't know if you are aware, but when you use a medicine, in a country because a country delivers a marketing authorization to sell the products or to deliver the products in the country. So in every country, one product in every country is marketed. We need one authorization per country. This is another challenge because some countries are fully fine in order to have greener products. And so we need to change the marketing dossier. If we change something in the product, including in the packaging, we need to apply a new dossier to require a new marketing authorization before to put the product on the market. And it takes time as well, sometimes months, sometimes years. What is challenging is that some countries disagree with the change. Just an example on vaccines. At Sanofi, we have decided 6 years ago to remove the PVC and the plastic of the blisters, so the packaging of the vaccines. Most of countries agree. So we have to change the marketing dossier, we have to apply, we have to convince regulators that it is the best way. Most of the countries say yes, excepting one country. So because of this country, we were not able to change the manufacturing plant, and so to change the line of packaging in this manufacturing plant. And so we have to produce specifically for this country, which is additional cost. And so we worked a lot in order to convince this country that this is the best solution for the environment, but also, in addition, for the healthcare professional, because it's easier for them to use this vaccine. So regulation in the countries, in every country, is by itself a roadblock. So we need also to manage this situation, and this is why we can't deliver so quickly. Sometimes we have the solution, but we can't deliver so quickly the product on the greener product. The last one, and I will stop there on these challenges. As I said, you know that the healthcare system is not resilient in many countries, and more than 82 countries today committed to decarbonize and to become healthcare system net zero. So meaning they ask a lot of questions to suppliers. We are, as a pharma company or healthcare company, a supplier, and require a lot of expectation in the product. So it's countries, a lot of countries not having exactly the same expectation. It's also institutions such as UNICEF for the vaccine, you know, all UNICEF, buying some products, but also some patients. So we have also to face different interactions with different actors and with different stakeholders.
So perhaps if we touch on profitability and sustainability, which of course is a key to allowing the sustainability credentials to carry through. Again, there's a lot of new programs coming into place for national governments. France's National Action Plan, 100% of all procurement will have to have a tag to it on the sustainability tag. You've got Germany's Federal Climate Change Act and NHS Net Zero plans in place. What does that mean for you in your role? So you've moved up to be more of a commercial role here.
So clearly we work with them. And so it's not a customer and a supplier. We started to create a different relationship with those government or those institutions in order to support them. For example, for France, I know very well, the French government has decided to implement an eco-score on pharma products, including vaccines also. And so we said, okay, but so eco-score just on climate is so maybe not the good solution. It should be on all environmental impact. And so we work together in order to define what are the expectations, which will be implemented in the tenders that are coming in France in the next month. Exactly the same with NHS. So so that making, if one or two countries start, the others will follow. So we need to work absolutely collectively in order to define what are the expectations you want, what do you want to achieve. It should not be greenwashing. Because we know some countries or some institutions say, oh, my tenders is green, I ask a green criteria, but at the end it is not added value for the environment and not added value for the patients. Because we know that if we improve the environmental footprint of our products, we improve also the environmental footprint of the care pathway, and for the patients, it's super, super important as well.
And so does this affect patients at all in the slightest in terms of the process that you go about in delivering these new medicines, these more sustainable medicines? It has no impact on the patients?
That has impact. That has impact because, as said before, 45% of CO2 emission of healthcare system is linked to the patient care pathway. And so one way to change that, and so countries are very, very willing to change, is to transform the delivery of care. And we know that, just an example with France, sorry again, but so before COVID, you wanted to be vaccinated for flu, you have to go to your healthcare professional to have a prescription. You are then going to the pharmacist with a prescription. You have your flu vaccines going to the fridge at home. And so you go back to the medicine, to the healthcare professional for the shot. After and during COVID, it has been decided you go directly to the pharmacist to have your shot. So you can see here that we gain a lot in travel of the patient. It's more comfort for the patient, and it immediately be in a safe condition with flu. So there are countries that are looking at to transform the delivery of care, and the products, the greener products, are also, and so we showcase that are also very, very useful in order to transform the delivery of care. And for the patient, they are fully willing to use greener products, having a greener care pathway as well.
So what you're saying there is you get the collaborative benefit of the financial imperative of the actual sell to the companies themselves, the health systems. You have the patient themselves also benefiting off the back of it, having better access to medicines.
Exactly. Exactly. And so in addition of that, so coming back on vaccines, for example, we know that, as said in introduction, that most of the disease which will be exacerbated by climate change are infectious diseases that are preventable by vaccination, and so vaccination will help to avoid complications. Will avoid to overwhelm hospitals. Will make some more comfort for the patient, and so to avoid having patients because they are not ill at all. So here we are working with the governments, with hospitals, with patients associations, with insurers, with payers, in order to push more vaccination, for example. And so we can say that we will improve the life of patients to avoid to be sick because of climate change, not delivering greener products. We need to be absolutely consistent. So it's not just only a requirement from regulators, from patients, from healthcare professionals or countries, but it's also most of pharma companies could say, and particularly us at Sanofi, that it is a matter of responsibility and sustainability, because we know it's important for the patient, it's important for the planet, and it's part of resilience of our business as well. And this is not just making good for the others and the planet, but so it's also to be resilient in our business in the future. So green vaccine is one of the solution.
Fantastic. And maybe just to close out, one final question is, what would you say in terms of the next biggest challenge would be to accelerate this process?
Accelerating this process needs, as I said, to change a little bit the regulation, and so to adjust the regulation according the speed that we can deliver new, greener medicine. I think that also we need to make more wake-up call of what is happening with the healthcare system and the impact on climate, but also we speak a lot of climate, but so plastic is a big issue. Most of people say, okay, you need to change plastic by bioplastic. Okay, but so bioplastic is recyclable. Okay, but in countries where deliver, for example, vaccines, there are poorest countries. There's no infrastructure to recycle plastic, or including bioplastic or whatever, paper and so on. So it's not the best solution. So every time we need to think that if we change something in order to make the product eco-friendly or more eco-friendly, what is the impact on the other environmental topics in order to ensure that we are making the right choice. And I must say most of countries are very focusing on climate change, which is absolutely necessary, but most of the time forget that water, nature is also a big impact, and plastic has also an impact on the healthcare system and the population as well. So we need to manage and to convince them that it is the best way to proceed.
Well, Sandrine, thank you so much for your time. I mean, you've provided everything there. You've provided us with healthcare and the environment, saving planet and people at the same time. So thank you.
Exactly. We try. Thank you.